On the night of July 21st, 2002, Jennifer Leanne Masson, a 25-year-old female in Brinsmead, Cairns, suffered a severe asthma attack on the front lawn of a friend's house. 6 minutes later, 2 paramedic crews arrived with intensive care paramedic Clinton Peters, who initially administered IV salbutamol in an attempt to open her airways, prior to her being transported to hospital. Miss Masson, who usually carries adrenaline, did not appear to have used it. On arrival, ventilation was performed with a bag valve mask and was then administered 2 milligrams of salbutamol intravenously. During the transport of Miss Masson, her condition quickly deteriorated and cardiac arrest was deemed imminent with bradycardia, cyanosis and a GCS of 3. 300 micrograms of adrenaline was then administered to account for her deteriorating condition. When she arrived at hospital, she was diagnosed with severe hypoxic brain damage. She lived in a vegetative state for 14 years until her passing in 2016. It was later alleged by the estate of Miss Masson that the paramedics who attended the call failed to administer adrenaline to Miss Masson earlier. The primary legal concept pertaining to the case is negligence and the duty of care upheld by paramedics. Negligence is the failure to provide a standard level of care, or in other words, the delivery of substandard care. The estate of Miss Masson sued the State of Queensland as provider of the Queensland Ambulance Service, claiming Mr. Peters' actions when administering care were negligent to the QAS Clinical Practice Manual. Within QAS, a paramedic has the duty to exercise reasonable care and skill in the performance of his or her professional duties. In order to prove negligence on the part of Mr. Peters, the trial judge established a duty and standard of care. The state admitted that they were responsible and liable for the acts, omissions and breaches in question. The QAS owed Miss Masson a duty to provide reasonable and appropriate care. The neighbour principle establishes a duty of care where someone can be closely or directly affected by their actions. The judge determined that the standard of care to be expected from the QAS paramedics to be that of the ordinary skilled person, exercising and professing to have that special skill. A professional does not breach a duty arising from the provision of a professional service if it is established that the professional acted in a way that, at the time the service was provided, was widely accepted by peer professional opinion by a significant number of respected practitioners in the field as competent professional practice. In order to critique the trial sufficiently, judges have to endorse logical analysis of the evidence to best form a valid opinion on the matter. Logical analysis is used by the judge to determine whether an opinion is actually supported by logic, common sense, and evidence. Throughout the 3 trials, Miss Masson's estate attempted to show causation for damages suffered. Causation is identified when the injured plaintiff shows that the loss or damage suffered was caused by the act or omission, breach of duty, or that the breach of duty materially contributed to the loss or damage. The outcome of Masson v. State of Queensland concluded that Mr. Peters was not negligent in the treatment of Miss Masson. The judge highlighted 3 issues pertaining to a breach of duty and also presented 2 further arguments that delved into whether those breaches of care caused damage. A credible body of evidence can be established through the use of expert opinion. Therefore, the plaintiff, the estate of Jennifer Masson, called upon several experts to offer their opinions on the administration of adrenaline to patients suffering from severe asthma. The expert witnesses called forward by the plaintiff in the first trial were predominantly doctors as opposed to paramedics. To properly examine the body of evidence, professionals with extensive out-of-hospital experience would be needed. The claim that the paramedics' failure to administer adrenaline materially increased the chance of the patient's deterioration beyond the chances of being salvaged by additional attempts at resuscitation was not substantiated. Mr. Peters considered both adrenaline and salbutamol as part of his treatment, yet chose salbutamol as the first-line option. In the case of the Ambulance Service of New South Wales v. Worley, ambulance officers are not medical practitioners, let alone specialists in emergency medicine. Their training is by no means insignificant, but it does not equip them with the theoretical knowledge which would permit a fine evaluation of alternative treatments. For in the realm of diagnosis and treatment, negligence is not established by preferring one body of professional opinion over another. In 2002, the preferred drug to administer in an extreme asthma case was adrenaline. However, there was equal evidence to suggest that salbutamol would be an effective treatment option. This was met with opposition by the defendant, which took into account the administration of both salbutamol and adrenaline. Foreseeability allowed Mr. Peters to make the decision that adrenaline may worsen Miss Masson's condition and cause more severe harm than if salbutamol was used. Foreseeability is described as when a reasonable person predicts or expects any harmfulness of their actions. The trial judge concluded that the paramedics provided a medically sound basis to prefer the administration of salbutamol to the administration of adrenaline at the time of initial treatment. Dissatisfied with the outcome of the trial, the estate of Miss Masson went forth with a subsequent appeal in 2019. The judge in this case found that the administration of salbutamol to a patient with Miss Masson's high heart rate and blood pressure was not supported by the evidence. It was thoughtfully considered that due to adrenaline being successful in treating Miss Masson's previous presentations of asthmaticus extremis, it should have been administered in a more timely manner. The Bolam test is used as an application in medical negligence cases. Bolam holds that the law imposes a duty of care between a medical professional and his or her patient, but the standard of that care is a matter of medical judgment. Trial judge favoured in view of the appellant, stating that Mr. Peters did not exercise a reasonable standard of care. With the case going to trial once again in 2020, it was noted in the 2002 adrenaline drug therapy protocols that the use of adrenaline may lead to hypertension, stroke, or life-threatening arrhythmia. Further consideration had been placed on the use of QAS guidelines and their supposed misuse of application. The estate of Miss Masson, claiming the paramedic's interpretation of the QAS flowchart was negligent, was found to be false as the clinical practice manual flowchart stated consider the administration of the named drug, not administer the drug, thus confirming the paramedic's interpretation. The QAS regimen has demanded that official documentation be critically analysed by paramedics when making clinical decisions. When considering Mr. Peters and other similarly experienced paramedics, questions are raised as to whether clinical judgment should be interwoven with the QAS guidelines. This is supported by the High Court statement, intended to guide and assist rather than to prescribe decision-making. This also presents an ethical issue as to whether paramedics should have to follow a flowchart or guideline when their experience and expertise leads them to deviate, if only mildly, from these guides. Had this been taken into consideration, results for the second trial may have been different. Using the balance of probabilities, which Rosenthal states is the requisite standard of proof which addresses the facts and contested facts of the case, the judge ruled that Mr. Peters was not negligent in his treatment of Miss Masson. In conclusion, the defendant did not breach duty of care or standard of care under the Law of Negligence and Limitation of Liability Act during treatment of Miss Masson. The dismissal of the plaintiff's claim is significant to the Queensland Ambulance Service and has had a great impact on the profession of paramedicine. This has enabled less restriction on what actions QAS can perform under the role of pre-hospital care. Historically, the role of the paramedic has changed drastically and is currently striving to establish a high regard in the medical field. Today's registration of paramedics as health professionals ensures paramedics are held accountable for their compliance with guidelines and protocols. Paramedics are taught to treat the patient rather than the condition that is presenting, which is crucial